This is Chad Saley with Comp Health. Today, I'm excited to sit down with Dr. Sonya Sloan, an orthopedic surgeon and locum tenens. And we're just going to talk a little bit today about what it's like working as a locums. So Dr. Sloan, thanks for joining me on the Zoom today.
It's wonderful to be here, Chad. I love Comp Health, and you've been a great asset to them for bringing social media to life for people that wouldn't have an experience with locums.
So to kind of dive into a little bit of kind of what it's like on a locums assignment, let's start at the beginning. So what do you do to prepare? How do you get ready to go on an assignment?
Okay, so there's two sides to getting ready for an assignment. One side is at home because, I'm a mom of three, married. My husband has a mega church here in Houston. So one side is getting ready at the house, and then the other side is actually getting ready to travel and be in another environment that I may not be used to. So I usually will, print off the assignments that is sent, the contract, that kind of thing. So you have all your points of contact. I'm still that old school person of digital is fine, but what happens if you don't have Wi-Fi or you don't have it printed, or can't get to it? So I do that. I normally load up all my apps, such as my, if it's United or American, Delta that I'm flying, that I have all of that information already loaded, ready to go. Hotel, sometimes there is a resending kind of thing for verification for the payment, making sure the hotel knows that I'm coming in late, usually, so that I don't lose my hotel. And then I'm Avis Hertz Gold members, Platinum members, Diamond members, since I've been doing this for a while, making sure my car is loaded and if I can change, upgrade kind of thing. And then mapping it out, especially if it's someplace I haven't been, the highways, even the side roads, like what other places can I get around if there's traffic, and thank God for Waze, the other app that you got to travel with. And then who's my point of contact and what time do I need to be there? Normally I will, if it's a first time assignment, I will drive around the hospital, drive to the destination upon arrival in the town. Sometimes before COVID hit, I would even go inside and sort of walk around, sort of the unknown person walking around the hospital. Can't do that now, but yeah, so I would know what I was getting myself into, if you will. And then I check in, and I always arrive early for the day before, because normally with the first time locums, they are not always anticipating, all the things you're going to do, from getting a badge to, having to have your orientation to, paperwork, whatever else needs to be done. So getting there early does help. And, and then on the mom side, wife side, I have groceries delivered and or go pick up some stuff from Sam's, whatever, meals planned. We have, assistants here at the house for the kids, for the driver of all events, taking pick up, that kind of stuff. And then we have a housekeeper that can help out with keeping the house clean, that kind of thing. So I make sure everything is scheduled here and everyone has the same schedule, so it runs smoothly without mom,
So when you get to the assignment, what's your lodging usually like? Are you usually in hotels? Are you in other places?
Comp Health has done both. Initially, early on, I've been with Comp Health for 14 years. So I'm probably one of the older locum tenens that brought it into being vogue, if you will. And we used to have houses. I've stayed in a house for one of my assignments in Virginia. It was like too big of a house. So eventually I think the hospital owned it. So I asked them to, let me move out of the house and stay in a hotel because I was just more comfortable. I've had apartments in Louisiana when I worked with Ochsner. The hospital would pay for the apartments, and I shared it with another locums person. So the week I was on, 1 week she was on, or whatever. So we shared one. I've had nice townhomes, for longer stints when my kids were younger, that I actually took them with me, and even a nanny. So 3-bedroom, 3-level townhomes, beautiful, West Virginia, DC area. And then most recently, it's just like extended stay. Hotels is usually the more norm. I like Marriott stuff, or Hilton. Hilton during COVID was great because you knew their cleaning routine. So it was like a must for me to stay at a Hilton. So normally I would stay in one place or another. But I do like having a kitchen, so if it's longer than a 10-day stint, getting like an extended stay that has a full kitchen, maybe a smaller living room, so you have space to live, so that's really good.
Yeah. How much I know that that we as Comp Health take care of a lot of kind of those details and things. How easy is it for you to kind of work with us to find places that you like to stay? And has your recruiter kind of, do they know your taste and what you're looking for? Like, how's that role, and how do we come into play with all of the travel and the lodging?
It's a great question, because when I'm telling friends about Comp Health or signing people up with CHG, there are all the different companies, but I'm like, Comp Health would be like the Rolls Royce of locums, if you categorize them. And so there's so many companies out there, and you want to know that they're going to take care of you. So this is one of the after hour contacts is excellent. So, when you can't get a hold of anyone, you want to be able to have an after hours person. And that is essential as a woman traveling by yourself for me. But like, not just my regular person that does my contracting, but then my travel team. I've had such great travel people through the years that have known me for a while, and then I get someone new and they learn me or whatever else. And it's, they can email me or they can text me, and they're like, oh, you're quick, you responded quickly. It's like, yeah, because I know, you're going to make me comfortable or not. They've worked with me from airline, making sure they have all of my United numbers and that kind of stuff. So the teams are important to be able to talk with them and be respectful to them, because they can make your stay very, very nice, or they can, not so nice. But Comp Health's team has been essential to, as soon as I get the assignment, I get an email from the travel team or a call from the travel team. We go back and forth on, you want a morning, the afternoon, they sort of confirm, and as you get into a groove, they know my routine. And so they'll say, well, we have this new flight. Do you want to try this? And I was like, yeah, no. Where I go now in New Mexico during anytime after November, December, January, probably up till March, I need an SUV that has like a 4-wheel drive, because they get snow and they get ice, kind of thing. So that's one of my new things I have to have if I'm going to go to that facility. So I think the travel team at Comp Health has been essential to making my life easier. I have worked with other companies, and it was hit or miss. It really was. And that makes a difference of who you're going to come back to, because if I'm not comfortable, I'm not going to go there to work to be comfortable.
Yeah. You talked a little bit about when you first get to an assignment, like if it's a first time assignment, that you'll drive there and you'll kind of check it out. Maybe talk a little bit about what the first day of an assignment is like, and maybe how it's different in a place that is new, like your first time there, or one like your assignment that you've been going to now for years when you go back.
I think it depends on who the assignment is with. So if you have a facility that has worked with Comp Health or has worked with locums, they usually have a routine. It's like cut and paste and repeat, kind of thing. I've been to several facilities that had no idea. And I was the first locums person there. And I swear I'd show up in Virginia. I remember specifically, like tri-state area, they were like, okay, what do we do? And what do we go? And what do we, and are you comfortable? Can we get you coffee? And it was like, meeting the bride for the first time or something, so it was like almost like on edge. And I'm like, I can work almost any place, and I'm used to different computer systems. So when you get there, part of the orientation for a first time is really the paperwork, which is usually done through Comp Health already before you even get there. We're not talking about, your hospitalization stuff, but it's like some forms you have to sign if it's Medicaid, care, that kind of stuff, documentation for them. Sometimes they want to see your license in hand when you get there. North Dakota, I've been drug tested, when I got there first day. So it just depends on the facility the first time. Other facilities, it's like, you come in, they expect you to know everything. They expect you to walk in, to show up with, you have a schedule and you're pretty much it. You go to one place or another. Sometimes they have a physician recruiter that will help you, walk you to different locations to get you oriented and get your badge and, that kind of thing. And then second time, third time, go around, you're on your own. They expect you to show up on time, you're on call. And I would definitely make sure the page operator had my number, because a lot of times they don't know your cell phone number is no longer a pager, kind of thing. I also give them the hotel number and the room number I'm in, because there's been places that the cell service was horrible and they couldn't reach me on my cell phone, but they could call the hotel and I was there or something like that. So that, and then you sort of meet the team. And so I say, as a traveler, seasoned locums, meeting the people that you're going to work with, it's like, being nice, being respectful, writing down names, like people take note if you're sitting there and actually writing their names down, versus like, oh, hi, it's nice to meet you. Hi, nice to meet you. It's like you go and you meet the OR nurse supervisor, you better believe me, you better write her name down, that kind of stuff. So it's the little things that people notice about you, of the type of worker you're going to be, as well as how willing they're going to help you while you're there, making your life easier too.
So after you kind of have gone through that initial process and the kind of the first day is done and you're into your routine, what is your daily schedule like, especially as an orthopedic surgeon? Like how are you spending your day? How much time are you doing consults, or how much time are you actually in the OR? Kind of tell me a little bit about what your day is like.
It depends on, again, what your contract entails. And so most orthopedic surgeons, you're doing clinic, you're doing ER, and you're doing surgery. Those are the three things that you're usually contracted to do. There's been places that I'm just clinical, like they just needed a 8 to 5, Monday through Friday clinical person to come in and take call. I've been places in, where else was I? Virginia was one where I just went in to take call. I never went into the hospital to round to see clinic or anything else. They just wanted me to be on call for the ER if something came in, and it was like a level 4 trauma. So they really didn't have an operating team on the weekend. So it would have to be stabilized in the ER and then shipped out. And I was responsible for doing that. I've been places where I've worked my butt off till well in the middle of the night, Minot, North Dakota, in Baton Rouge, Louisiana, like a level 1 trauma. And I was willing to do that. So I operated all night, and then woke up a couple hours and I was in clinic all day with 3 PAs and a CAS tech and a whatever, so it just depends on the assignment and what you're willing to do and what you're comfortable to do. And I think that's very important, to be honest, when you're looking at different locums positions, because they'll push you. They'll ask you to do a lot.
Do you find that when you're there, like you're there to work anyway, so you want to work as much as you can, or do you try and keep a schedule, and do you ever even try and like go out and get to see the community or do anything outside of work, or is it kind of like, I'm there and I'm working?
Well, my agenda is different. So my agenda is to make money, so I go to work. And so therefore, if I'm able to get more hours, that's what I'm going to do. There's some people that I work with that are locums doctors that I'm on 1 week, they're on 1 week, and, they're there to see the world, so they want to take the bike hikes and the day getaways or whatever else. But if you're on call, it's sort of hard to do. I will say, always ask the locals what is good, what to see, what not to see, where to go, where not to go, where to eat. So they know all the back, restaurants and little coffee dives and, that kind of stuff. So I ask a lot of questions. I make notes, on my phone, just so if I'm coming back, I know to go try this place, or, don't go to this place, that kind of thing.
On the topic of food, are you just eating at the hospital most of the time, or do you get to have a chance to kind of get out and find those behind the scenes local places?
If I'm on a long-term, like usually I do at least a week to 10 days, I usually will take my lunch, because you don't know what the cafeteria will have, and different cafeterias are good and some are not. And then dinners, I usually try to find the local hangs, the local dives, because that is part of the exploration. That is part of the fun. I'm a coffee hot house person, so I want to find the little coffee houses and, the places that no one else would ever, you'd never have another chance to see this place. And so it's that.
So kind of the reverse of my very first question, for how do you prepare to go? How do you prepare to leave? You talked about like sometimes you're on for a week and then another physician's on. How do you handle kind of like handing off patients, or how's that transition work when hey, I'm leaving tomorrow, what do I need to do?
Yeah, so there's 3 parts to it. One is, your timesheet. In most places you have to have a timesheet supervisor sign your timesheet. So you want to make sure that's done and taken care of. Secondly, run the list. We call it running the list, meaning like who's in house, who are the patients in house that they may need to round on, what room number they're in, what's their diagnosis, what day they had surgery, what they may need in the next couple of days, whatever kind of thing, sort of like the plan of action. And then lastly, it's pretty much with the team that's there. So that means some of the nurses, the ER staff or whatever else, hey, this is the next person coming in. Do you have their number? I'm leaving at 8 a.m., kind of thing. It's like, it's sort of CYA, but it's also to make sure that Comp Health looks good. Our reputation is like this person left it better than, why they were here, kind of thing.
Yeah. So my final question just on this topic is you talked about when you're there to work and get paid. How does the pay for locums compare maybe to kind of a regular full-time job, or what you would expect if you decided to put out a shingle and become just a full-time orthopedic surgeon?
I think it's very comparable. That's one of the reasons why I've done it. I think it's about lifestyle, choosing what you want. So I'm in a different season of my life. It's like I want to be home. I have several other businesses. I'm the wife of a pastor of a megachurch in Houston. So my lifestyle is different and what I need. And so therefore, for what I'm willing to be paid in my time and attention, if you will, it's very good. It's very good. What some other places, like if you're a medical student, a resident that's coming out and, just trying to decide what you're going to do, where you're going to go, I think it's a great opportunity to see the world, or see the States at least, and make some really good money. I would definitely recommend being on top of your taxes, because it's like a 1099, you're a 990 employee. So therefore, knowing your taxes, the tax shelters that you can have in place, financial stuff that I wish somebody would have told me the first 3 years, where I made quite a bit of money and paid a lot of taxes. So understanding that Comp Health is definitely comparable to work to get the higher contract price for you. And it's always negotiable is a great point too. I've written my ticket sometimes, like, you're the only person that's licensed in that state, and you're the only one that's willing to do ortho trauma, and you're available that weekend. Guess what? You pretty much can name your price. Is that I've done that. I've worked government. I'm on a Navajo Nation right now, so it's not as great as what I've made, but for the hours and what I'm doing, it's so great for the service that I'm providing and at this point in my life.
Oh, that's great. Well, thank you. I always appreciate talking to you, and look forward to doing it again.
Yes, thank you.